Okay, so now we are on to trail guide number 3 for the pelvis and the hip. We are going to the tailbone trail. So you'll want to have your patient in prone for this one. You're going to, again, find your landmark. So we know iliac crest is one of the easiest landmarks for us to find. If you drop down into the sulci, you're now on the PSIS, correct? If you drop just a little bit inferior to that, or if you go caudally to your PSIS, you should be on the top of your sacrum. We know that the sacral bone actually is very much like the shape of your hand. So if you're on the PSIS, drop down about half an inch to an inch inferiorly. If you just place your palm of your hand, you should feel that inferior angle of the sacrum underneath the palm of your hand. So you can also come in and palpate that. This is also a very strong connection for a lot of fascia. A lot of those gluteal muscles come into play during that area. So important to really notice what do the tissues feel like underneath there. Can really be a sore spot for your patient as well. I don't know if Dr. Rovig is a little sore today, but can also be a sore spot for your patients as well. Something to think about when they come in with complaints of back pain or that piriformis syndrome, something like that. You're going to want to check the attachment sites into there. So if you're from here, you're going to drop down. If you're on that inferior angle, if you drop down, making sure that your thumbs stay pointed towards one another, make sure you're not diving in at all. So they should remain flat against the skin. If you're on that inferior angle, you're going to drop down probably about an inch, and you're going to push cranially. So if you're pushing cranially, you should feel the coccyx, and it might be a little bit deeper on some of your patients. And some patients actually have a rotated or a flexed coccyx, so it might be hard to palpate with them as well. So try and figure out if that's the case with your patient right now, or maybe some of your other patients that you might go through. Okay, great. Oh, sorry, one more. SIJ. So, yeah. So we're going to find the sacroiliac joint. So if we think about as the sacrum and the ilium come in and connect with one another, you have a small spacing and a connection. So you have articulation at that point. So one of the ways you can do that is you can find the PSIS, drop just a little bit off of that, and you can rotate your patient in and out. You should feel just a slight movement underneath your thumbs and your hands. You're not giving deep pressure, because if you give deep pressure, you're not going to be able to feel that. So you should give light to medium pressure to be able to feel just a little bit of gapping in that area. So you might move. Okay, yep, so you might move that as you move forward and back. You also, it's a little bit easy, and Dr. Rovig had a good suggestion that while we're here, we actually covered the greater trochanter. So we know sacroiliac joint, we're going to roll to the outside. I'm going to show you on this side. It's a lot easier to do on the side closest to your body, but I want you to be able to feel that greater trochanter. So again, you're going to do it with the rotation of your hip. And if you just watch Dr. Rovig here, you can kind of see that she pops in and out. So if you get your landmarks again, so you're at your iliac crest, if you drop just inferior to that with a nice broad contact, rotate the patient, flex the patient in and out, you should be on the greater trochanter. From there, you can actually go into that gluteal tuberosity. If you're on the greater trochanter, you're going to come just a little bit medial and inferior. That's a big attachment site for your glute medius, glute minimus. It can also be one of those sources of pain and soreness because of not only the muscle attachment, but this whole area has a very thick fascial component to it as well.